Good afternoon, everybody, and welcome to the budget hearing on Tuesday, August 11th, 2026. I'll note that we have a quorum of members present. We've got a variety of different departments presenting today, so we'll allow each department to go. After a department presents, we'll allow for questions, and then move to the next department, and then come back at the end for any wrap-up questions and call anybody back forward at that time. At this time, we'll get started and invite Police Chief John Toom forward.
Greetings, councilors. Police Chief John Toom here to present to you a 2027 budget. Again, what we see is $64.6 million within our 2027 budget, which will hit some of the highlights as we move through this presentation. Again, our key focus areas, as always, are maintaining and fostering relationship with our youth. Community policing continues to be something that we strive for. We've talked about recently the traffic safety enforcement piece is a huge piece that we're working on and would have major importance to our community. And again, continue to leverage technology, real-time information to maximize the effectiveness of our officers. Again, we serve, protect, promote quality of life is our motto, and we try to live that out each day. And you'll see within our budgets the different areas that we have and the financial obligations that come along with each to total up that $64 million budget. Again, key initiatives that we're looking at within the next year, but also continue to be initiatives, our street outreach collaboration, our traffic safety and enforcement. We've talked a lot about our uptick within saturation patrols and different tactics with to work through that. Increased criminal apprehension through our violent crime unit and real-time information center. And as always, many of you were a part of, neighborhood outreach extends beyond just National Night Out. It takes place throughout the year and in a lot of different ways. Looking at our crime clearance rates, we bring this up in almost every stat presentation, but also within our budget presentation, is a key indicator of the work our officers do every day. They do outstanding work and continue to clear cases high above the national average, and that's because of the skills and abilities they have as professional investigators and as law enforcement, but also the support this council and mayor's office has shown to give them the tools necessary to do the job that they need to do. You'll see within this budget year, 7 FTEs, 6 police officer positions, and 1 animal control position. Animal control is kind of the unsung hero of the first responders. I think people don't realize the amount of workload that they take care of at close to 18,000 calls for service per year. In honor of that, devoting one of our FTE positions to that position this year is of key importance, and looking for ways in the future with which we support that animal control mission along with our police department mission. Again, continually roughly 130,000 calls for service per year, which maintains pretty stable. Over 6,000 accidents, 43 officers onboarded within the last year. These numbers are actually fairly consistent and stable when we look at a calls for service and accident standpoint. And we continue to hire and work closely with our partners in HR to try to solve one of these issues, which is one of the challenges in law enforcement nationwide, which is the hiring of officers and maintaining them through field training and getting them functional and out on patrol. Revenue budget drivers that you look at within our budget, if you study our budget book, we do show some revenue, and a lot of that is the government shared function is a lot of our federal grants, whether it's operation of highway safety, officer wellness, HIDA, JAG. There's other grants that come through which helps kind of supplant some of our additional funding, which allow us to buy some things and do some different initiatives. One of particular note is the operation of highway safety grant, which helps fund extra speed enforcement, but also this year the major emphasis of that grant is DUI enforcement. I'll be excited to share with you the numbers at the end of the year, but our DUI enforcement has gone through the roof. I think there was a misconception that because we weren't catching as many drunk drivers that people were making better decisions. The reality is with some more money and some extra enforcement, we're seeing more and more DUI and impaired drivers, which again contributes to public safety. And we'll continue to keep that emphasis as again, it's shown a different area that we need to spend a lot of time on. Operating budget, again, you'll see this with a lot of city departments. When it comes to the budget, it comes to people, with 80% of it accounting for full-time wages and benefits. Again, another pass-through between our budget, I think it's $2.5 million, is the city's fundings towards Metro's communications, and you'll see that there. Advancing technology, you'll hear this time and time again from law enforcement, not just here, but around the country. Technological advancements are key to make sure the efficiency of officers are maintained, and especially with the depressed hiring pool, that technology continues to be something that we look at, along with other miscellaneous charges there, which you can look within the book, or if you have any questions, we'll cover that. Which brings us to our operating budget major drivers. We broke this down a little bit more than in previous years. And what you'll see, if you have particular questions, we'll get into it. But some of the changes come from just things that cycle through. Wages, obviously, with a raise, contractual raise that's coming through, will produce a change in the budget. But also just things like SWAT armor, which get to the end of their useful life and have to be replenished, and other technologies that come through, as well as just tools and equipment that need replacing as part of the operating costs and the price of doing business. If you look at our capital program, $1.9 million, patrol vehicles are obviously a big chunk of that. It takes a lot to keep our fleet rolling, and our cars run 24/7. Most of them go from shift to shift to shift, which means that they have to be replaced at a regular basis. We have a great collaboration with Fleet and does a great job of keeping our vehicles on the road and giving us the support that we need, but the price of vehicles continues to be there. $116,000 for radios, which again, we've talked with this council a lot about radios, the importance of investments that we're making, some of the best technology to better serve our officers, but also better serve our community. Animal control vehicle, some other equipment, and then a dog that's within the budget to replace or to add to our K-9 program. So again, some pretty standard operating costs for police business, but again, the prices that continue to drive that. As we take the longer look out, I've talked with this council and council members have come and gone, but what you'll see mainly of note on this is what's earmarked as East Side Station. East Side Station would be 2029, the design for a southeast, what we're referring to as a substation near 69th and Cliff to put that footprint down in the southeast part of town. It's been in the plans for a couple years, and we kind of pumped the brakes on it because we had some land identified. The idea being a lot of times in the city, we need to wait and make sure we have the right piece of property with the right growth possibilities. And this co-located piece of property at 69th and Cliff, where we plan to collaborate with the fire department, is going to be key for our service to that southeast part of the community, which will continually grow and rapidly expand. So what you see is 2029 earmarked for design along with fire, and then in 2031, some funds for either debt management or some of the funds that are needed to get that project going. We'll determine some of those things as we move forward, but it's important that you recognize in the capital plans. Since I've become chief in 2021, we've been talking about this southeast project, and to see it on this plan and know that we're headed in the right direction is key for the southeast part of our community. At this point, take any questions that you may have, or if you'd like to dismiss me and ask me questions later, that's up to you. So,
Thank you, Chief. Councilors who'd like to get us started? Looking down that direction first. No? All right. Councilor Thompson.
Thank you. Quick question about animal control, since you are asking for another officer. Can you kind of describe to the public when you call animal control or not? For instance, if I have a bat in my house, I'm probably not calling them, but if there's an injured deer in my yard, maybe I do call them.
I mean, it is pretty much any animal problem is defined within our community, and that includes bats, which is one of their primary calls. There actually are some components with bats that are very important that they have to handle, to include injured animals, as well as animal abuse and neglect cases, and even some wildlife management issues that come up as far as geese by the airport or beavers building dams over public work projects. There's a lot of varied responsibilities that come along with animal control. And I know this in particular because I'll pay attention to the calls for service screen that pop up, and you'll consistently see these calls for animal control with a very small unit that's going out to deal with those. And so I think part of the issue is to give them some more resources, but also we're going to take a look at some of the call types they're going to, evaluate those, and find maybe if there's other ways we can find efficiency within that. But I can tell you, if you look at calls for service per first responder, they're some of the hardest working folks out there. And as I think of the past year highlighted some really unique cases as far as catching venomous cobras and other unique things that they're called upon to do. And so we really want to make sure that we support them in that way.
Thank you.
Councilor Basie.
Thank you, Mr. Chair. Chief, I think I ask you this every time you present,
Yep.
talking about filling those positions.
Yeah.
We've got 6 police officer positions, but my assumption is that those being posted today, we're not having them filled tomorrow. Can you talk a little bit about the timeline or investment, or when we'd actually be able to realize that increase to the force?
Sure. I think naively when I first became chief, the idea that we could get to full staff and maintain full staff was something that I specified as a goal. The reality is that the cyclical turnover of your workforce, when you have 308, now after this 314 officers, will just be something that we continue to experience as people retire. I think we have close to 30 or 40 retirements over the next 5 years. but also the workforce coming in and moving on to different directions. But also the reality is that attrition becomes, we have a high standard, so wear this badge and wear this uniform, and not everybody we hire makes it through the field training. So one of the things we'll look at from a strategy standpoint is we have been able to hire above authorized strength. We've worked closely with finance to make sure that within our budget, there's the constraints to work with that, where if we get to the point where we can hire ahead to prepare for the future, we're allowed a threshold with which to do that. So we have the tools and mechanisms in place. It's my own personal hope that within the next couple of years, we'll see a resurgence of interest within our profession that has still continued to suffer post-2020. As I talk to chiefs nationwide, especially agencies our size that have as many positions to fill, the cyclical turnover just becomes something that we have to look at. So again, challenges within law enforcement, but again, ones that we're willing to look at different ideas on how do we overcome those challenges.
Thank you.
Counselor Oppenheimer.
Thank you, Mr. Chair. Chief Tim, two questions. One is a simple one, just on the vehicles. How often are police vehicles replaced?
It depends on the vehicle, but on average, we put roughly 100,000 miles on these vehicles, and then they're looking at replacement. We used to push the threshold into like 120, 130. What we found was diminishing returns. These vehicles run continuously. It's not like your average car, the abuse and stress that they take. And so when we get to that point, we're putting more money into repairs and keeping them rolling than just cycling them out. So at about that 100,000 mile mark, a healthy vehicle program is working through to cycle those through, but they can reach that mileage within 2 years depending on the shift. Again, we've covered 85 square miles within our community, about 18 miles of drive roadway from the northeast to the southwest. We put a tremendous amount of miles on these cars.
Can I have
Go ahead.
another? And the other question I had is regarding the dog, $18,000 for a dog. I'm curious to see, is that to do with training or how does that work out
So,
financially?
yeah, we don't necessarily get just any dog. Within police service dogs, there's a lot of things for like odor detection, which you could train a beagle, a lab, or something like this to do. When we look at apprehension dogs, we are buying dogs that have already been trained up to a certain point within these disciplines, are usually over a year, almost 2 years of age. There's a little bit of maturity of them. So we're getting a dog that is more quickly moldable, and that just tool or that equipment just costs more money than just getting an average dog. We're asking him to do pretty extraordinary things, and this is where breeding, bloodlines, and different things that come up become kind of key and vital. So the going rate, we have a supplier that we work with. A lot of these dogs are even sourced from Europe that have a pedigree or a bloodline that works in these different disciplines.
Thank you very much.
That's great. I hear there's puppies always at Turner County Fair as you're entering.
Yeah, I was going to say we could just go down and get some Australian shepherds and do something with them. So,
Counselor Akue.
Hey, Chief. Night bars, they seem to be like a crime hotspot. How effective would it be to have, let's say, a station police unit from 9 to 3 p.m., let's say Friday to Saturday?
oh, sure. So right, like overnight bar issues and hours. Yep. So for as long as I've been a cop and prior to my being a cop, where alcohol is served and people gather, tend to produce issues. If you look through the history of Sioux Falls, just in my lifetime, whether it was the Pomp Room Jams, Night City, Borrowed Bucks, Coconut Joe's, Lava Lounge, Lalabella, Pave, working through this, you kind of get what I'm getting at here. This is a continuing evolution. And so I think of particular note is the event over the weekend. The reality is that there was two marked squad cars in that, at least two marked squad cars in that parking lot 15 minutes prior to the event. And so the challenges and abilities to be us everywhere at all times while still maintaining a call volume, you'll find that especially Fridays and Saturday nights during that bar close time, our call volume goes up. So we look at different strategies, different ways to employ it. Kind of the comprehensive issue on some of these issues is then taking time to meet with bar owners and managers to talk about what's taking place outside this ecosystem of this establishment. So, yep, you look to employ different strategies, but sometimes, and I'll tell you this, especially in a post-2020 environment, law enforcement's presence is a deterrent, but not the deterrent that it used to be. There still is some people that have some escalating behaviors when it comes to that, and we'll continue to work on that challenge. Because, yeah, it's of great concern to us as well, and one that we talk about quite a bit.
A lot of smiles in the crowd about Borrowed Bucks, so I think that shows everybody age
Yeah.
right there.
We're all children of the 90s or early 2000s.
Counselor Spellerberg.
Thank you, Mr. Chair. To Counselor Baisey's point, you've done a much better job with being able to hire officers now, but retention still seems to be an issue in that position naturally. We're trying to look to see whether or not we want to get back to that public safety grant that we had, but we're out of funds on.
Yeah.
Did you see any effectiveness of that from a retention standpoint? I know we maybe didn't have the right guidelines in place to make it for firefighters and police officers, but is that something we should continue?
I think it's a good benefit, but when I say it's a key factor in retention, I can't say that's the case. You've seen our marketing or our advertising change over the years. I think we used to cast a pretty broad net around the country as far as where we were placing ads. What we found is that people with ties to local areas and local community are the ones that tend to stay. So in that regard, if there's a housing or if they have a house here, but part of our retention issue too is just the challenging nature of the work. And then we've seen now where people ultimately desire to go back home. When we hire officers from different parts of the upper Midwest, a lot of times we're a step up to get back to where home is for a lot of them. So we'll continue to look at solutions. I think a lot of the incentives that could be offered are ones that the city's going to explore, and I know it's been a priority of the mayor's office, but it's my objective too to keep collaborating with the state. There's a lot of ideas I've pitched legislatively with the state with which to support law enforcement, and we'll continue to work on that. I think one of the key things and factors that's really hard and our community needs to understand is that we could be fully staffed and we could have more officers tomorrow. All we have to do is lower our standards. The reality is that our standards are extremely high. To wear this uniform, to put on this badge and wear this patch, we're asking a lot of the officers, the young men and women, and they're stepping up to this profession. And what maybe works out in some of our smaller communities within the state, as far as call volume and challenges, we have a really strong challenge here as far as getting them through that field training. I think one of the things you'll look at, we'll try to do, and this is something we've challenged our staff with, is reassessing our training program. Do we need to add more time? Do we need to add more resources? Do we need to add more things within that training to provide that for metro policing, as opposed to when we were a smaller community? There may just be some moves we have to make which in order to support that training process to get people where they need to be.
So was that a yes?
So yeah, I mean, to be honest with you, any incentive you can throw from a police and fire standpoint, we want it to be taken advantage of, but I also don't want to give you a false indicator that it's driving huge amounts of employee or activity that comes along with it.
Got it. Thank you.
Yep.
Counselor Pankin.
Yeah, thank you, Mr. Chair. And Chief, I have a question on slide 9, and it's this $454,000 for family safety support. A lot of the other things were making sense to me, but I just was curious about what family safety support is.
I believe that would be our contract with the shelter for family. Where's Sam? I can't find him anywhere. Yeah. So when we looked at the RFP proposals and the different projects that came through, one of the things you'll find within law enforcement is that we deal with the end result of some very bad situations. In response to that, we look at key community partners that support our mission, and the Shelter for Family Safety is one of them. That I believe that mark and those funds are worked within. They continue to support victims of domestic violence, provide a service that government simply cannot. I think one of the ways that we look and prevent future issues or crime is by supporting victims and making sure they have the support to get them where they need to be. And so I think if you see money like that, it's with great thought and great consideration that we are providing funds to some of these nonprofits, because in many ways the service they provide we can't, but they also potentially decrease some of our call volume and workload by producing meaningful change for people.
Thank you. One more.
Yes, please.
Yeah. The next slide has $116,000 for replacement portable radios, and I was just curious about those radios, if they're kind of true radio waves, or
yeah, I bet.
Explain those.
I'm trying to think who was on the council the last time we talked about this. There's probably a whole education piece that we could provide some of the newer counselors. Our previous radio system, and through great leadership through Metro Communications and our friends that are working on some of these radio issues, we've changed technology. The old technology was very tower driven and tower reliant based on traditional wavelengths and radios. These new radios are looking more at a ability to use not only the traditional radio waves, but LTE or cell phone signal, as well as Wi-Fi through public safety networks that are established. So the upfront cost of these radios is a bit more. However, the service that they provide, and I provide this anecdotal story just because I think it's important for your question on radios. It was very common for first responders, once they got deep into an internal building like a school or a hospital, to have no signal under traditional radio waves or means. Under this new program with LTE and Wi-Fi available, we should be able to have our radios push into buildings deeper where there was traditionally barriers, and our radios will still function and work. we've had great reports with this to change the landscape of what we see with impaired driving within our community.
Great, thank you. We'll call you back up if needed at the end.
All right, thank you.
All right, this time we'll move on to the fire chief, Chief McGravy.
Well, good afternoon, councilors. Thank you. It's a pleasure to be here this afternoon. Very proud to represent City of Sioux Falls and Sioux Falls Fire Rescue with this 2027 budget. I'd like to thank our team with finance, especially our business analyst, Sam Stanforth, with helping put this together. And then my entire leadership team that's back there, especially Assistant Chief Bukovic. He's key in developing this budget and bringing all the programs together. Our budget request for 2027 is $49.3 million, covering both operating and capital. A few key areas of focus for us in 2027 will be continuing to maintain service while keeping up with the growth in our community, making sure that we're impacting all the citizens across our community equitably with our services. One of the ways that we're doing that is with opening Fire Station 13 in the northwest area of town, looking to do that in Q1 of 2027. Additionally, working alongside our coworkers with Metro Communications and implementing emergency fire dispatch protocols for more efficiency there. The emergency management function is looking at developing a strategic siren replacement program to make sure our outdoor warning sirens are reliable and repeatable. And then fire prevention, working to streamline both the planning and the inspection fees through our community. Some of the impact that those dollars have, as you look here, fire protective services with the personnel costs, and that is just under $40 million. And then you'll see that we have about 4.5 that goes into the capital programming to help support that. Fire prevention totals to about 2.3 million, doing both building inspections as well as permit work, centralized facilities to maintain what we already have, and then emergency preparedness again with 550,000 to help make sure that our community is ready and prepared in the time of emergencies. Those key initiatives again, opening of Fire Station 13, the fire dispatch protocols, as well as being good stewards with dollars, our budget dollars, and making sure that we continue overtime management strategies so that we keep that in check. One of the national standards that we track very closely is our travel time. That's the time from when our first responders receive an alert until they arrive on scene. The national standard for that is to arrive within 4 minutes of high priority emergencies within 90% of the time. Presently, we are trending closer to that. In 23, you can see we were at 72%, and in 25, we were able to reach that in 74% of the time. So continuing to monitor the networks, put systems in place, and locate our stations so that we can move towards that national standard. And then full-time positions for fire rescue without Metro Communications. The Office of Metro Communications is 243 with a 0 ad request for this year. A few key statistics are calls for service, 16,710 in the year. We performed over 4,600 commercial inspections, making sure that we're keeping the community safe there, and then operating 82 outdoor warning sirens for early alert. Touching briefly on the fund side of the ledger, the revenue side, so government shared services were just over 1.6 million. The lion's share of that is from fire premium reserves. They go from fire premium insurance and then gets a reversion back to the fire departments. And then we have other charges, which include charges when we send units out for wildland deployments, as well as when we have inspectors at other entertainment venues and that. And then 25,000 is kind of a placeholder for when we're out there and we find people or other agencies in the community that are willing to donate to our fire alarm program so that we can keep that program sustainable in the community. Much like Chief Toom said, the lion's share of our budget is personnel. Combined with full-time wages and overtime, we're just over 86%, followed by the facilities and insurance, equipment, technology, and then ancillary pieces. Those continue to get bigger and more expensive. So we have 2 replacement engines as well as a new engine in the 27 budget, as well as the repurpose and remount of an EMS unit that we presently have, rescue equipment. And then of note, you also see that we have $420,000 in there for warning sirens, of which $70,000 is for new sirens so we can maintain that network as our community continues to grow. But additionally, $350,000 of that is to replace aging units we have in our community. The 5-year outlook, Chief Toom spoke to it. We're looking to partner with PD on a southeast, would be Fire Station 14 for us. Appreciate working with finance and looking forward at designing that a year early in 2029. So we have the plans for that. So as we look at funding opportunities for that with the ultimate opening and funding of Fire Station 14 in 2031. And then you'll see the equipment spread out through there. That's various different engines, ladders, and equipment as we look to replace those on our normal cyclical cycle. Then last slide, just kind of going back to one of our key initiatives of making sure that we maintain coverage throughout our community. Probably one of the points of pride is the work through finance and the SLAT team is identifying next fire station locations. So you see in the Northwest, we have Fire Station 13 that's presently under construction, but additionally through the cooperation there, we were able to secure and purchase 3 other locations in the 3 other quarters of the community. So wherever the community develops, wherever Cotter decides to put in more sewer, we're ready to go after them and provide emergency services. So with that, I'm happy to stand down and take any questions.
Thank you, Chief. Questions for the Chief? Counselor Basie.
Thank you, Mr. Chair. Chief, one of those dots is in a part of town that I care a lot about. And I'm wondering if you can talk through how you guys determine, now that you've got land for all those different ones, how do you determine what, you're going to break ground on first? Do you have anything based off of number of people, or is it just strictly utility? Is that kind of thing?
Typically for us goes off of response time and looking at the tier mapping. So planning and public works, they go through and very regimentally develop what's tier 1, tier 2, and tier 3. So you see the one that up in the northeast there is right on the edge of our boundary, and there's currently development around that. Additionally, sans any kind of major development going in there and driving the time frame there, the majority of the land above that is tier 2 and tier 3, which gives us time to get out into that community. Where you look where we're down in kind of that south central, that southeastern portion, there's a large percentage of that community that's already developed around it and pushing some of those response times. So when we looked at kind of moving forward with the Northwest, because initially we were looking northeast a couple years ago with the development of Foundation Park and all those, were really driving our response times in there. And one thing that's kind of challenging or is a tension for us is there may not necessarily be call volume, but as we try to provide that service equitably, that as we were starting to see response times get upwards of 9 to 10 minutes, we saw that there was a need to cover that area. So it's a tension, I would say, that certainly with infinite dollars, we would be in all of those areas already, but we know the impact of bringing on those 15 FTEs in that capital program and what that does for strain for the rest of the budget as well.
Thank you. And if I may, switching gears a little bit, you kind of alluded to an ambulance or an EMS unit. We had exhaustive conversations when renewing that contract not all that long ago. How much of this budget is in relation to the fire department's responsibility for the few EMS units that you do still have?
Yep, so we have presently have 3 transport ambulances in the system. 2 of those are staffed on a consistent 24-hour basis. The one that we're remounting last year, I think, would have came in quite a while ago and is set to be retrofitted. So we're actually taking that body, putting it on a new chassis so that we can have it in reserve status. So that would be the part that in this budget is specific to adding redundancy to that. When we went through the conversation last year, I kind of equated out to when you take both, since we aren't adding additional staffing, what we do is we cross-staff those. Those are already staff that we have in place in fire station. So it's a 5% supplement to their wages for them to operate as paramedics. So between the 5% supplement for those paramedics as well as the recurring cost for those ambulances, which we expect to be in service for upwards of 15 to 20 years, I put a cost of about $75,000 annually to us providing those 2 ambulances at 24/7, 365 coverage, which is an incredible bargain. The impact that that's had on those critical calls in our community, no private ambulance service could rightfully provide that. We're working with community partners, and as they're looking at having to stand up a full-time staffed ambulance, it's in the neighborhood of $1.5 million annually to have an ambulance ready to go, 2 people on board to staff it at all times.
Thank you.
Yeah.
Counselor Oppenheimer.
Thank you, Mr. Chair. Chief, a question on, well, first a quick question. Fire Station 13, when is that scheduled to open?
We're looking to have that Q1 of 2027. I believe I just overheard they had a construction meeting. They're running a week or two ahead of schedule. I shouldn't jinx that, but we've got footings in the ground and they're going to start laying block either this week or next. So good quality partner on that. And we have a strong team with engineering and our own internal people to go through and get that up and running.
Great. That's good to hear it's ahead of schedule.
Yep.
The other question I had was regarding charges that we send out to, I think it's T that we partner with, where we help provide firefighters to them or fire stations. Is that under charges or under the government shared?
It would, I'm not sure which, it would show up under charges there. The current mutual aid agreement we have with our surrounding community, we don't bill for the first 12 hours that we go out and provide aid. Likewise, they would come into the community and they've done that different times when we need additional resources in. So the first 12 hours, we just go out and provide that. After that, we have a set rate that we would bill them out to and it'd go under other charges there.
Thank you very much.
Yeah.
Counselor Kue?
Hey, Chief, could you please just expand a little bit? What are the main drivers of overtime and what measures are you taking to reduce that number?
Yep. So the overall number that we have there of 2.25 million for overtime, just over 1.25 of that is contractually required through the Federal Labor Standards Act. So firefighters actually, we aren't bound by a 40-hour standard week like everyone else. On an annual or an average basis, firefighters earn 3 hours of overtime every single week. So that's just built into the cost. It's an efficient way of doing business. It's just what happens when you have people on duty 24 hours a day. So when we move beyond that, there's about 660,000 that is attributed to staffing that when we fall below 53 is our normal staffing with 12 stations and we have to bring in additional people. And then there's other pieces in there. So when we send crews out on wildland deployments and we get recouped for that, but then additional our fire prevention staff inspectors, when they go out and provide services, that's another overtime that shows up as an expense, but we recoup through charges. Probably one of the most significant pieces that we did with the recalibration through the last administration to manage that was we've moved to a model where we host two cadet academies annually to try and keep at full staff as much as we can. Previously, we were hosting an 18-week academy once a year, and whenever you would have a candidate drop out, you'd have somebody get injured, anything, you would have to wait an entire year to be able to recognize that person back at full staff. With the two, we both shortened what the academy is and drove some of that training to the floor and operations, as well as by having two, we're able to go 6 months, get back up to full staff and try to recoup and recover some of that overtime that would have been generated. Yeah.
Counselor Spellerberg?
Chief, same question to you on the public safety grant. Do you see it as a benefit, retention, hiring, any of those things? Is it important to you guys?
I think the members that have taken up on us greatly appreciate it. I think with the scale of it, and it's such a small number of people that are able to do it, I think that there's potential, there's other ways that we could utilize those dollars if we're looking to specifically focus on retention or recruitment.
Got it. Thank you.
Yeah.
Thank you.
Counselor Siggety?
Thank you, Mr. Chair. Hi, Chief. Thanks for the presentation. I know one of the things that came up with this in the past 12 months, I can't remember when, but this Wall Township came to us during a meeting and kind of talked about who's servicing the landfill. Can you kind of give us an update on who's now servicing the landfill, whether it's us or the volunteer department in Wall Township? And then do we have other townships that are touching the city that are kind of, we need to work out agreements with, or what does that look like?
Yeah, so specific to the landfill, we worked with both Wall Township as well as Hartford Fire Department to say, look, it makes sense, this is our resources, it makes sense that we respond out there. So they were in agreement there that it makes sense that Sioux Falls Fire Rescue responds out and we handle our own equipment there. As far as other communities, as we continue to grow, it continues to impact those. We look to be really good partners in that. We're not ever looking to go out and take over or annex intentionally for fire protective services, any of those, but if they come in and talk with us, historically we had covered Wayne Township out to the west side of town. That was one where the township came in and they said, look, we dissolved our fire department, we're looking for fire protective services, because fire protection is an essential service in the state of South Dakota. So both townships and municipalities have to provide that service, either through a service of their own, through contract. So those township supervisors are required. They came, ultimately what we ended up coming to for a fee after a few years was more than what Hartford Fire Department was able to provide their service for, so they now contract with Hartford. So I'd say that we're open to those conversations. But we also need to make sure that we're being not only good partners out in the region, but also being good stewards of the assets that we have in the community. The citizens of Sioux Falls spend real dollars on their fire protective services, and it's not something that we should just give away to surrounding communities because they aren't able to provide that. Everybody kind of needs to have a skin in the game.
Okay, thank you.
Counselor Pankinen?
Thank you, Mr. Chair. This is a follow-up to Oppenheimer's earlier comment or question, and you mentioned that those calls to service that you don't bill for the first 12 hours. And is that on a specific call, or is it like the first 12 hours of some other time frame?
Just strictly for mutual aid. So anytime we go out into another one of our neighboring communities, if we provide aid, essentially once we get there, the timer starts. I'd lean on Assistant Chief Bukovic. I don't know that we've ever been beyond 12 hours on a mutual aid response, so we haven't had that. That was just something we learned. It's a very large mutual aid compact that we're in there, and I think it was kind of driven from the state of Minnesota. They put it in that they're like, look, we need some protection that if we're there for an extended period of time, so it's there just kind of as an emergency stopgap, but it's nothing that we do very often.
So just to kind of sum that up, it is the 12 hours on that call, like the first
Correct.
12 hours on that call. Okay.
Yep.
And then I had one other question on when you were talking about fire prevention on slide 15, you mentioned that it's for building inspections and permit work. And I was just curious if you kind of have your own staff, or if it kind of goes into a pool that's in other types of inspections and other types of permits as well.
We do. We have fire inspectors. We're at 8 fire inspectors presently that handle the specific International Fire Code inspections related to those permits. I would share that it's been certainly one of the topics of recalibration is how can we streamline and be more efficient, because we have health has inspectors, planning and development service has inspectors, we do. But additionally, like there's a specialty in what they do. The code book for fire protection specifically is in the neighborhood of thousands of pages. So to say we have a health inspector that's now going to go out and check fire sprinklers isn't necessarily reasonable. We're making sure that there's overlap and awareness that where can we be more efficient there, but presently those are in each one of our own areas of expertise.
Thank you.
Yeah.
So,
Counselor Thomason?
Two quick part question. The first is, with how fast our city's growing, what technology or what do you guys have that, when I drive to a friend's house and they've just moved to a new part of town, the Google Maps is telling me to make a U-turn because it thinks I'm in the middle of a field. And so how do you stay on top of that? And then secondly, how much training do you guys do with the city growing so much to make sure that if there is a fire in a brand new part of town, you know exactly where that road is, we're getting there quickly, et cetera, et cetera?
I would say that we're incredibly fortunate in the community, the civic analytics division that we have. I've seen in a number of different national publications, as well as just internal meetings we've had, is second to none. So if anything, from our perspective, they're actually so on top of it that there's times that roads go into our road network before they're even paved. So I don't have a lot of concern there. That's into a proprietary network that we have through our computer-aided dispatch. So we don't necessarily have issues. I'm not saying we're perfect, but like those are in there and sought after. And I mean, as soon as something is annexed, it's put into our system. They're a very well-operated machine there. But then the second part, as far as our people out training, it's part of their daily duties. So the Public Works Division does a good job of noting when there's street closures and that, but our people are continuously out in their territories inspecting both for new construction, new building, new commercial properties, as well as access. Because like I say, sometimes those roads will be in, you know that it's dirt, and they'll be formulating second and third order plans of what other equipment can we bring in if it's muddy and we have to get to X, Y, and Z. So I'm very proud of the systems that we have in place there.
All right, thank you, Chief. We're going to give you an opportunity to take a rest.
Thank you.
We'll invite forward Metro Communications. Counselors, we can come back at the end after we get through all the departments as well, if there's other questions on anyone. Welcome forward the manager of Metro Communications. Good afternoon.
Good afternoon. Amy Chase, Metro Manager. I appreciate the opportunity to come before you today to discuss the key initiatives and drivers of our $8 million budget. As we look at the next year, our priorities remain focused on maintaining reliability while preparing for continued growth. 911 is obviously a critical infrastructure, so we will continue to keep our primary focus on making sure that we have redundancy both at a local level and partnering with other emergency communication centers across the state, so we have that redundancy statewide. We're also looking at technology. Improvement in technology allows us to keep up with continued growth while also continuing to maintain operational efficiencies and finding those opportunities where we can. One of those is the implementation of Emergency Fire Dispatch, or EFD. Currently, we use a protocol for our medical side of the house, which is EMD, or Emergency Medical Dispatch. This allows us to operate the same way for fire-related calls. And really what that does is it allows greater consistency and enhanced service across the community for those fire-related calls. And then as we go through the next year, certainly strong partnerships with our partners in public safety remains one of our top priorities. So as we look at some of our performance metrics, you'll see here not only as call volume continues to increase across the city and the county, we provide exceptional service to people when they dial both 911 and non-emergency. You can see there we not only exceed our city goals, but also nationally recognized standards. So nationally, they look at answering 911 within 15 seconds, 90% of the time. So when you look at nationally, they're looking at 90%, and we're hitting almost 98% of the time. You've heard potentially some stories across the country where different emergency communication centers are really struggling to answer 911 in a timely manner. Sometimes callers are having to wait several minutes for that call to be answered. Our average call answer rate is 3 seconds, which is simply just one ring, which is pretty phenomenal. As you see, we are requesting an additional FTE this year. That FTE continues to support our operations, and we would place that as a non-emergency communications operator. So last year, we started a new program which was very unique to certainly our agency, but really across the country, where we split our operations. So we now have non-emergency communications operators, which are responsible for answering the incoming 10-digit lines. And then we have the emergency communications side of the house, which answer our 911 lines and provide dispatch services. So this additional request would go to the non-emergency side. About 3/4 of our incoming calls are non-emergency calls versus emergency, and we've certainly seen the benefit of that program. From a workload perspective, you can see here, we answered just over 300,000 incoming emergency and non-emergency calls, and that generated just over 200,000 calls for service. So not every call to our agency generates a call for dispatch from one of the 26 departments that we dispatch for. Some of that is, it might be multiple callers for a single incident, or oftentimes we get calls from people and it's not a public safety request. So we simply direct them to the appropriate location and provide that service that way. As we look at our revenue growth over the next year remains relatively modest, and it reflects normal growth rather than really any significant changes. You can see there the amount that's provided by the 911 surcharge fund, and then broken out by the additional city and county contributions. The additional is services that we provide for Brandon Police Department and our ambulance service. To echo both chiefs that went in front of me, our operating budget is predominantly driven by personnel, as we look at full-time wages and benefits being 77% of that. The other breakdown is really looking at our technology and the systems and infrastructures that we need to make sure that we're maintaining those service levels for the community. And again, as you look at our operating budget, major drivers, nearly all of the growth is attributed to personnel costs. Everything else remains relatively stable from years past. And as we look over the next 5 years, our capital plan focuses primarily on scheduled replacement of critical equipment. So over the next couple of years, we're looking at replacing our radio consoles that are at each position within the dispatch center, as well as our consolettes, which is our backup radio system. Earlier, I mentioned redundancy, and this is one of the ways that we maintain that redundancy for radios. And then if you look out into 2031, that green bar indicates a replacement of our recorder. And that is something that is replaced every 5 years. So with that, I would open it to any questions that you might have.
All right, Counselor, who has a question for Amy? Counselor Basie.
Thank you, Mr. Chair. I'll maybe just bring up, I asked the police chief about this because I know it's all interconnected.
Yes.
It's been a short while that we've had this working relationship, but it sounds like the team, recruitment, all of that is just flourishing in comparison. Could you talk just a little bit about that? And I'm also thinking about planning for the future. You've got an FTE request here, but also making sure that we have these really important roles filled.
Certainly. I will say that we are in probably the best staffing position that we've ever been, certainly in my 26 years and even earlier than that. Currently, we have 55 employees, and we have 4 new employees that are slotted to start in just a couple of months, which will actually bring us to full staff. And I hate to put that out in the ether, right? Because that's kind of the white rabbit that we haven't been able to catch in the past. But due to a lot of factors certainly coming under the city and the resources, just the environment, the support that we get, our talent acquisition team within HR has been amazing at finding us the right people and going through and really digging into what characteristics do we need. And it's been pretty phenomenal.
Thank you.
Mm-hmm.
Any other questions, counselors? All right. Well, Amy, I think I would say sometimes crickets is really good.
The Chiefs answered everything for me. I appreciate that.
It was not crickets 3 or 4 years ago, so I really appreciate your leadership. It's absolutely fabulous that we don't hear anything from the community because that means things are doing absolutely fabulous. So great job. Appreciate the leadership. Keep it up.
Thank you very much.
All right, move into the Health Department. We'll welcome forward Director Kipley this afternoon. Good afternoon.
Yes, good afternoon. Joe Kipley, Public Health Director. Good to see you all. Let's see if I can get to my slide deck here. For the Health Department, we've got a $20 million budget for 2027 proposed. Some key focus areas. We always kind of fall back on the community health assessment to keep our priorities grounded in what we hear from the community, that resident survey and focus groups that we run every 3 years. So that dates back to the 2025 cycle that outlined access to dental care, adolescent mental health, and general healthy living, lifestyle, wellness issues. We also are focusing on optimizing our downtown clinic. As you get familiar with our budget, the biggest portion of our budget is Falls Community Health, the medical and dental clinic. So always looking to optimize. We've got a few good things going on there. And then general collaboration. We kind of position ourselves downtown in kind of an ecosystem of health, medical, social services in the downtown area. So partners like the Link, the Sioux Falls School District, Parks and Rec, other public safety partners, all looking to improve community health and safety. So again, when we're looking at our health programs, the clinic is the biggest, and in particular the medical clinic is where a lot of the driver of the dollars are, but then also the dental clinic. And then, but don't forget that we've also got things like health code enforcement, our ambulance quality assurance, oversight over our ambulance provider, and then vector control, mosquito control is always a fun topic in the summer months. And then we've got line items there for community connected services. Those would be some pass-through dollars to some of those nonprofit entities that we frequently partner with. So some key initiatives I'd highlight when we talk about the community health assessment. Of course, we're continuing to prioritize those items from the 2025 cycle, but now we're past the midpoint of that 3-year cycle. So it's kind of fun. Now we get to be working on the 2028 community health assessment. So this fall we'll be doing some surveys in partnership with the health systems. Sanford leads that, Avera leads some focus groups, and then by this time next year, we'll be setting out what should our priorities be and then publish the 2028 community health assessment. So kind of fun pivot point where we're still prioritizing some things from 2025, but starting to write towards 2028. And then the other key initiatives kind of just going into the supply and demand and efficiencies of the clinic. Again, we're optimizing the efficiencies, and I can give some examples if that interests anybody. But otherwise, the real big one is leveraging this updated Medicaid reimbursement rate. That will be the eye-popping item when we get to the line item in the budget of new revenue growth. When we go from a medical visit for a Medicaid patient returning $210 to $336. When we go to from a dental visit from returning a reimbursement from Medicaid going from $210 to $390. So that was a major change. So if you run into any legislators, you can thank them for the increase to the federally qualified health centers across the state that Falls Community Health benefits from. And then we've conservatively budgeted, though, on our revenue in the sense that while we have a goal of increasing total patients seen at the clinic by 12%, the budget we've baked in basically assumes prior year clinic volumes. So even staying flat, our revenue pops up just because we can see the same number of patients, but when those Medicaid patients when Medicaid reimburses us that much better, we're going to see better revenue. Then I've got a few fun facts here. We always look at response times. Amy mentioned, Metro answering that phone, and that's just the first in a series of events of response time. So Metro is doing their job answering the phone and then dispatching, and our ambulance system is especially I highlight priority 1 calls, so those would be like a classic cardiac arrest or something where time is definitely of the essence. Got the prior years there. I can report in 2026, I think we've only had 1 fallout in 2026 so far, so we're at 99% as well there. So the ambulance system continues to operate well. Some other fun facts, clinic visits, just to give you a sense of scale there, that's 10,000 or so unique patients. Every unique patient on average sees our clinic, either dental or medical providers, 3 times a year, so that ends up being 32,000 total visits. Mosquito control program, trying to really emphasize getting upstream on that, literally and figuratively, I guess, the preemptive, going and larviciding and putting preemptive treatment in the spring, and then ideally having to do fewer spray events, sending out the spray trucks. We have had 5 total West Nile virus cases in South Dakota this year, none in the Sioux Falls area. Then facility inspections, our health code enforcement, great partnership with the planning department where we shifted some of who does what inspections, and they're more out in the neighborhoods. We are more the facilities, and this is things like restaurants, lodging, tattoo establishments, and in-home daycare. And here is our big slide from thanks to our friends at the legislature and the Appropriations Committee and the State Medicaid Office. Our net charges, so in healthcare, basically, your doctor's office can charge whatever they want, but then your insurance company or state Medicaid has a contractual adjustment, and then there's what we call net charges. So basically the net revenue to the clinic. And so we see that jump from $4 million in 2026 up to $5.7 million, and almost all of that is not assuming that we're going to see more patients or pie in the sky projections of growth of the clinic. It's basically just given our current patient population, but with better Medicaid reimbursement. So that is a big win. The clinic, still not at break even. The city does subsidize Falls Community Health. It runs a negative margin, but knowing that margin is going to be $1.6 million better in 2027 is a great step forward. Going towards the expense side, we are definitely in the people business, caring for people and having people with servant hearts that work in our clinic and in public health departments taking care of people. So full-time wages and part-time employees comprise the majority of our budget, but also, again, we have those community services support that are basically pass-through dollars to support at-risk populations, street outreach program, opioid settlement dollars that go to the link, et cetera. And again, our expenses can be mainly comprised of our wages and benefits, and then those pass-through dollars are going to be some of the top items for expenses. Capital program, pretty boring in the sense of we don't have a lot of capital equipment for the clinic, but I will note that we built in the possibility of getting a rural health transformation grant for dental equipment. We've had 4 grants submitted. 2 of them have been not denied, 1 has been accepted, and right now that dental equipment is actually in one of those that was denied this cycle, but we hope to apply again in 2027. So when you see this slide here, that 2027 is kind of aspirational. The grant-funded dental equipment and a grant-funded vehicle, those are things that we're applying to the state, and the Rural Health Transformation Grant funding, which is a 5-year program, $1 billion around the state. And so we'll see if we can be competitive for those, but we will only purchase those things that we would get the grant funding in those categories. So I think that is my presentation. Open up for questions.
Thank you, Director. Councilors, who has questions for Director Kipley? Councilor Basie.
Thank you, Mr. Chair. Director, this time last year, we all were using our favorite word, recalibration. And as part of that discussion, if I recall correctly, your team, as well as planning, I think code enforcement under planning, were working on maybe consolidating or integrating tools, platforms, systems. I don't think we've heard an update or progress on that. And I'm also wondering if or how it impacts the budget.
So the net effect there, I think there's general efficiencies. Maybe Director Penfield can fill in some gaps for me as well, but of how planning has seen that going from an implementation standpoint. But again, the main shift there was planning finds themselves in the neighborhoods already looking for vegetation, snow, different things that are zoning issues. So what they picked up from us was the health code violations would be the classic example would be your neighbor has a whole bunch of garbage in their front yard or backyard. The idea that lands in the health code because that can attract pests and nuisances from a health perspective. So they take that on, and basically we shifted an FTE to balance that out. So net effect to the city on FTEs, it's a net neutral. So we just shifted 1 FTE to planning. But is the idea that all of that work is now done more efficiently? We believe so. It also decreases the odds that one address is going to have 2 different inspectors from health and planning come and cause confusion to the neighbors and to the residents. 2 different departments from the city are after me now. What is this notice of violation versus this notice of violation? So now it's streamlined through the planning team. Will be that health still is on standby to support and answer questions in kind of this period of transition. But I've been very pleased with how the planning team has stepped up to the plate and made that more efficient. So we see that we'll be able to focus more on facilities, and Fire Chief McAravey kind of alluded to it. Are there some things while we're in physical structures like a restaurant, can we be looking for things and tipping off the fire department on things like fire extinguishers or exit signage and things? Can we add that to our checklist? So this is an ongoing evolving process of when we have inspectors going out in the field, can they know what their other fellow teammates across the city departments are looking for and add to each other's checklists and do that efficiently?
Did those things exist in 2 separate systems or ticketing systems before?
So we are in the InterGov IT, that IT software platform for those code cases, like going out to the neighborhood for vegetation violation and for garbage in the front yard. Those were already in the same system, and so now, but we just have 1 team that's looking at them.
Okay, thank you.
Thank you.
Councilor Oppenheimer.
Thank you, Mr. Chair. And thank you, Director Kipley, for this budget. I love one where revenue goes up more than expense goes up. It's always a plus. Question I had was regarding the grant for the dental equipment and van and medical equipment that's in here. Assuming we received that grant, there would, I'm guessing, be an addition to staffing as well. Is that also built in here?
So we do have basically the 1 grant that we've received so far through Rural Health Transformation has some offsets for existing FTEs, basically tasking people with certain elements of what the purpose of that grant is. It's basically some Medicaid readiness. Medicaid's going to be changing some of their platforms, and some of our data people in the clinic are going to be building towards that, but it's no new FTE. It's just allocating their time to that. And then the equipment would not be new FTEs. We are looking at expanding our dental clinic services, but the expansions that we're talking about also are in partnership that I'm hoping in the next couple weeks I'll have some more information for you, but looking at partnering with USD's dental hygiene school And so it won't necessarily be new city employees, but Falls Community Health patients will be served by the dental equipment in question and things like that will actually be operated by USD employees or students.
I love that. Thank you.
Counselor Pankinen?
Thank you, Mr. Chair. I think it was on slide 36 early on that you mentioned the oversight of the ambulance provider, and so I wasn't sure if one of the line items is, we can see the actual budgeted amount for that oversight of.
So it wouldn't be in that exact line item. I could sure have Sam, our financial analyst, from itemize it out for you, but basically our duties within ambulance, we'd have a EMS quality assurance coordinator, and then we would also pay for the salary of the part-time medical director. So there are two, one full-time employee and one part-time within the broader health budget that is our personnel allocation to provide that oversight. And then there's also one other part-time underneath the, so 3 people provide the city's oversight of the ambulance. And then that information funnels up to our citizen board, REMSA, that helps also provide that oversight on things like response times and quality metrics to make sure the ambulance company is doing what it says it's going to do.
Great, thank you.
Counselor Kui?
Thank you, Mr. Chair. Director, I often get complaints from constituents that the link is becoming another revolving door program. I mean, obviously it offers our community much relief, but is there a broader vision for that program?
Yes, I think we're going to have some more information for y'all very soon on that. I can report that the link, what we kind of called the link 1.0, has now become the link 2.0. I guess those are kind of my words, but the board has changed over, and there's a new board of directors to the link. They have a meeting at the end of this month where they're considering kind of those operational vision, like what do we mean by Link 2.0? How do we improve on something that has been a good step forward in our community, but we all kind of recognize it has room for improvement, and how do we make it even better? How do we have it serve its purpose? So I think on the other side of that board meeting, I think the link is going to have some information to share with you of what's that next step. Obviously, the link is looking to city, county, Sanford, and Avera as stakeholder funding, and so the city budget sits with you, and you want to keep investing in the link, but you want to know that it's doing the best work with those dollars. So that's completely understandable. Right now, the link does run a structural deficit. So some things are going to need to change, either reduction in services or new revenue, just to make the math work. Something is going to have to change at the link. But I kind of want to let the board of the link plot the map forward of what some of the next steps are going to be. So I think you'll be probably looking for maybe if you see fit, an informational briefing going into this fall. The other thing that's pending for the link is state opioid funding. So this next round of funding, basically the State Department of Social Services has signaled that the link in Sioux Falls and the Care Campus in Rapid City are going to be prime candidates for an infusion of kind of bridge funding to keep them going. So I'm overall optimistic about the link, that some things are pivoting in the right direction that will look to kind of short to medium term sustainability, but then we have to plot out a long-term strategy for the link as well. Thank you.
Other questions? Director Kipley, I have 2. If you go to your increase in staff, full-time benefits and wages, just kind of a tick above standard a little bit. Can you kind of unpack that a little bit?
Yes, that is a good catch there. That is not so much an increase in 2027 as 2026 was an artificially low baseline. Some of the different recalibrations we were looking at this time last year involved some of those other partners kind of to joint venture on some things and share some employees and things like that. And those opportunities fell through. So rebasing to where our full-time clinic staffing at is basically budgeting those back in, and then the normal increases that you'll see in every department. And as we've talked about, the benefit increases are at a slightly higher rate. But yeah, it's not so much an increase in 27 as it is a rebasing from 26 being a little bit artificially low as we were shooting for different partnerships that might have driven down our full-time costs in 26. But we have stayed within budget within 26 due to some vacancies that are normal in clinic.
This isn't meant to be a negative statement, but based upon that, is it fair to say that the recalibration conversations that we had in 25 did not bring the savings that we anticipated?
I don't know that I would say that. I think there were a lot of just moving targets I'll speak just for my department, that there were different partnerships that are in the works, and then some of those fall through, some of those move forward, some of those allow us to, like basically the reference I was making earlier, can we partner with an academic program like USD Dental Hygiene so that I don't have to make a request to hire 5 new dental hygienists? Can we use the integrate and make part of our mission an academic mission and have students be part of our clinic? So those are the types, without kind of going into which deals fell through and which partners didn't end up working out. Basically, I would just kind of leave it at that there were just some moving pieces, and in collaboration with finance, we just made our best estimate of what that was. And so kind of recalibrating both full-time, part-time, interim positions. We shot too low in 26 for full-time, and now we're back to where we think we need to be.
Thank you. Final question I would have would be to follow up on Councilor Kouy and Link 2.0. You mentioned Link 2.0, and then you mentioned us holding the purse strings. And one of the challenges we have is we're scheduled to approve the purse strings second Tuesday of September. Feels a little uncomfortable approving the purse strings before we hear the plan. So I guess my preference would be is we hear the plan before the second week of September, before we're asked to approve the funding, because I'd like to see the plan before we approve the funding versus approving the funding and then getting the plan after the funding's been approved. Does that sound, am I being reasonable?
I think you're being completely reasonable. I know we have, the city has a board member on the Link's board, Michelle Treasure, so I don't want to necessarily speak for the Link board as an entity, but I think what you're requesting is very reasonable, so I think maybe we just need some offline discussions to signal what is expected to happen at the next board meeting. I just don't know that I want to declare what I think is going to happen at the next Link board meeting in a public session right now.
Sounds good. Thank you. We'll let Mr. Conda answer as well.
Tim Conda, City Finance. I just want to add to that what's being proposed for the 27 budget for the Link is opioid funding, so it doesn't come from the general fund available balance. So just keep that in mind as well. That's part of that opioid funding, that settlement dollars that we received.
Thank you. All right, councilors, any questions on that? Councilor Pankinen, back to you.
I have one other that I should have asked earlier, and so thank you, Mr. Chair. And Director Kipley, it's on the grants. There's $3.789 million that was in the 2026 budget under the grants. And so did those come in at that same value, or was that?
Yes, those grants are going to be mainly the grants tied to us being a federally qualified health center. So $3 million of that is what we get every year from the federal government just as to be that type of clinic. And then we also get on top of that Ryan White funding. So that'd be to fund some of our programming for patients with HIV/AIDS. And then there'd be a series of some smaller grants, but those would be, yes, the very kind of standard year-over-year normal funding of a federally qualified health center.
Great, so you're confident that those will come in 2027 as well?
Yes, we do have to, I think it's a 4-year cycle now, we have to compete for that main $3 million grant, and we are up in the next year for that, but we've been a federally qualified health center for 41 years, so we're pretty stable and our numbers look good and we're meeting all of our federal metrics, so I don't anticipate that being at risk.
Thanks.
Councilor Basie, come back to you. You're not going anywhere, Director.
I'm trying.
Thank you, Mr. Chair. One more question for you, Director, as I'm looking through the budget book here. And revenues, which during these conversations are always really nice to see higher numbers there, but I just want to better understand the commentary. I'm looking specifically at page 87 in the budget book. An increase in revenues in charges based on actual trends and increased Medicaid reimbursement rates. So I'm wondering if you can unpack what that means.
Yes, so actual trends, meaning the number of, we're not fudging the numbers thinking, well, we'll just see more patients next year on some trajectory. This is actuals as in either 24 or 25, I'm trying to remember our baseline that we use, but actual trends, so this is real information that we know our clinic is capable of moving through this volume of patients. But then in the algebraic equation of patient times reimbursement equals total revenue, holding constant the total number of patients, that's actual trends. We think we can definitely serve at least that many patients. Just the variable we changed is the reimbursement rate. So now when you're seeing every one of those medical patients and you were multiplying by $210 per patient, now you're multiplying by $336 per patient. So the equation, the the other side of that equation is the revenue is obviously going to go up.
So what I'm hearing is that it's not necessarily in this 40-some% increase isn't based on a significant number of new patients. It's an increased reimbursement rate.
Yes, and that's why we think this is conservative. It's just if we would just run the clinic exactly the same, we're always looking to improve the clinic, but if we just ran it exactly the same, just because one of our major payers, state Medicaid, is paying us more per visit, we know we're going to get $1.6 million more in total net revenue.
Thank you.
Any final questions there for the director? All right, thank you, Director Kipley.
Thank you.
All right, move on to the Siouxland Libraries, and welcome forward Director Boysen.
Good afternoon, Alicia Boysen, Director of Siouxland Libraries. Thank you for your time this afternoon to give me an opportunity to go through our proposed 2027 budget for the library. This year's request for the library is $12.9 million. The library is here for everyone, and our goals are pretty simple: to serve the literacy, technology, and community space needs of our guests. And for 2027, that work centers around 4 key areas. First, our early literacy and kindergarten readiness. Few organizations in the city can reach young children the way that the library can, and our school partners continue to reach out to us saying that kids are not ready to start kindergarten. A child who is not reading proficiently by the end of 3rd grade is 4 times more likely to drop out of high school. When we can help children get ready before they enter their first day of kindergarten, that's where we can make the biggest impact on our community. Second area of focus is adapting our library collections and our services. So focusing on our growing demand for digital materials, expanding self-service through our kiosk pilot, and making sure that our buildings are a place that families want to visit and return. Our third area is our outreach, and we're looking to expand that in 2027. We currently run 22 community stops per week, and this brings services into more neighborhoods like our Westside Lutheran Church, that's up in our northwest part of Sioux Falls, and our Cathedral neighborhood. Some of the Cathedral neighborhood, for example, is not very far from the downtown library, but there's a main artery street that runs there, and that can be a real barrier for families, especially young kids who are looking to visit our library. And when we can bring the bookmobile up to them, it helps us reach them and it helps them get to our services easier. Lastly, we'll be looking at our strategic plan and developing a new long-term strategic plan that fits within the budget constraints. So we're measuring our success against the summer slide with our summer reading completion rates. In 2025, we had 57% of the kids who signed up completed the program, up from 54% just 2 years earlier. And we're targeting a 60% completion rate this year. Summer reading is one of the strongest tools we have against the summer learning loss. And when there's loss over the summer, this widens the gap between kids when they return back to school. We have 3 main initiatives for 2027. Our first one is we're looking to relaunch a summer reading program tutoring option for the summer of 2027. And we also want to measure how well our system-wide programs are being attended. We'll install our first Anytime Library kiosk, and then also that 28 through 32 strategic plan. The library currently has 63 full-time positions, and we don't anticipate increasing that. Here are some of our top services we provide, and our demand continues to grow, as you can see by these charts. Community space use has grown over the years, starting at 13,000 in 2023 and up to 16,000 uses in 2025. And we're continuing to see that trend even in the first half of 2026. Our meeting room use is up 52%, and our study room use is up 14%. People continue to use our buildings for remote work, meeting spaces, and gathering more than ever. Our materials, we've crossed 2.3 million items in 2025. Our guests continue to make that shift to the digital materials. Digital materials grew from 486,000 in 2023 to 679,000 in 2025. Our community is reading more and using us more every day. And increasingly, they're doing it on their own devices with digital checkouts. When it comes to digital services and our computer sessions, serving more people online doesn't necessarily relieve or have less demand on our staff. And actually, in many cases, it increases the demand for our staff. A good share of our guests that come in to use our public computers have little to no basic computer skills. They need staff members to walk beside them to help set up an email, to navigate a website, or to fill out an online application. As more of our everyday lives move online, our guests are asking our staff to navigate online benefits, job applications, and even helping set up appointments. This hands-on help becomes more essential every day, and it's a real part of the work that our staff do. Outside the city funding, our largest revenue comes from Minnehaha County. We currently have an agreement with Minnehaha County to help fund the 8 rural locations that we have. So their support will be up $80,000 in 2027 for a total of $1.6 million. Because it takes people to help every guest who walks through our doors, to lead a story time, or support parents as their child's first teacher. As all the other directors have said today, wages and benefits are the main driver for our budget. Breaking down our budget a little bit here, most of this year's increase comes from those inflationary items such as wages, technology, and facilities. We do have one area of note where we are seeing a reduction of $150,000. This was an elimination of a duplicate platform we had called Hoopla. So that digital downloadable service, that demand has just shifted to another platform we had called Libby or Overdrive. Our digital magazine collection includes over 100,000 titles. This service has not seen a price increase in over 5 years, and our guests will continue to have access to unlimited magazine checkouts in 2027. The other areas such as programming, furnishings, training, communication, those all remain flat for 2027. Our capital program is at $1.4 million. The large majority of our budget, about $1 million, is our library materials. So this is both our print and our digital collection. That collection is our books, audiobooks, and the digital title licenses that people check out every day. Equipment and technology is $185,000. Those are 2 forward pieces of technology we're looking to add to the library kiosk, and then an interactive learning table. Our outreach vehicle is $120,000. This is an additional bookmobile we're looking to purchase to grow our outreach and to make sure that those 20+ weekly stops that we're doing remain as efficient as possible. We're carrying 2 projects from 2026 into 2027. That's updating some signage at a variety of our buildings. So here in Sioux Falls, the Oakview, Ronning, and Cayley branches will get new signage. And then we have 4 branches out in our rural locations that will also get updated signage. And then we'll be doing some shelving replacement out at our Brandon location. Looking out over the 5 years, our capital program remains mostly flat year over year with $1.4 million in 2027 and $1.3 million in 2029. The additional request in 29 is for the replacement of our large step bookmobile that we currently have, and then with the 1.1 million every year for the other 3 years, mostly being our collections budget. I want to close on a couple of 2 big projects that we look forward to doing in 2027. And I think this will show kind of the direction we're looking to head, where we can continue to grow our access at a very low cost. First is our neighborhood outreach van. This will bring library services right into neighborhoods, reaching families who live far from a branch or face other barriers from attending or from coming to a physical location, with early literacy materials, programming options, and staff right on board. The second one is our Anytime Library Kiosk. This is a self-service lending point with a small footprint and no need for additional staffing. Putting these kiosks out into the community where our guests already are gathering. Both of these help us extend the library's reach across Sioux Falls and Minnehaha County without the cost of a new building or additional staffing. So our focus this coming year is on growing access and literacy in a way that our budget can sustain. So to kind of conclude, our $12.9 million request will sustain our 13 branches. It helps us continue to circulate 2.3 million items, We will be hosting over 3,000 high-quality literacy and kindergarten readiness programs, and we'll be able to get out into the community over 1,000 times through our bookmobile stops. Appreciate the time this afternoon, and I would be happy to take any questions.
Thank you, Director. Councilors, questions? Who's going to get us started? All right, Councilor Oppenheimer.
Thank you, Mr. Chair, and thank you, Director, for that presentation. The question I had was regarding the Anytime Library kiosks. Where are you planning on locating them?
We're going to start with city-owned locations already. We've identified an area out at the West Side Rec Center where we have some opportunity to do additional programming at that location, as well as put the Anytime Library kiosk in.
Thank you.
Other questions? Councilor Basie.
Mr. Chair, I'll just make a comment rather than a question if that's
fine.
allowed.
Go ahead. I'll limit it to a minute.
Ooh, a whole minute. Director, I just want to say thank you, because you and I have had a lot of conversations this time last year about the services, about the facilities, and the reach of the library system, not just in the city of Sioux Falls, but to the other rural communities that have school districts that overlap with our city boundaries as well. I'm really excited about the Anytime Library kiosks and the neighborhood outreach and the updates that you've provided to me along the way, and even eyeballing Frank Olson when that's built and having some sort of library interaction with that. And I just share the story. I was out at the Oakview Neighborhood Association's National Night Out, and there was a bookmobile there. I thought that was the coolest thing in the world because there were a whole bunch of kids that were playing soccer and bopped over to the bookmobile. So I just wanted to say thank you.
Any other thing else? Councilor Pankinen.
Thank you, Mr. Chair. 2 questions. I'll be as quick as I can here. The first one is on that Anytime Library kiosk that'll be out at the West Side Recreation Center. Is the media planned to be in that kiosk? Is it only books, or are there other media types that are planned to be within that kiosk as well?
I'll toggle back. So this is what they would look like, and there are slots in it. So there is a limit to the size of the book and the thickness of the book that we can place in that kiosk. So some of the other things, like we partner with Toy Lending Library, we wouldn't be able to borrow that out of that, or we have Discovery Kits, we wouldn't be able to borrow something like that out of. They would need to attend a bookmobile stop or one of our physical branches to get those type of materials.
Okay, sure. And I may be dating myself, but it wouldn't be DVDs anymore either, right?
We do still have DVDs, and they do fit into that machine, so those would be available in there.
Okay, and then my other question would be, you mentioned 2.3 million items in a year circulated, and am I correct that 679,000 of those are digital?
Right.
So that means that 71% are still paper books?
Paper books, and then we also include like our electronic databases and our computer usage in those numbers as well.
Okay.
So it's like the things that people use from us.
And then one follow-up question to that is, how long does a book stay in the library system and not being checked out at all before a decision is made to not keep that book in circulation anymore?
It would vary based on the type of material it is. So we use the CREW, thank you. We use the CREW manual to determine how long that item stays in. So a nonfiction would maybe have a longer period than a fiction title. It all depends on the collection.
Thank you.
Director, got just a couple quick. If you look at security increases, it's safe to assume the security increases the changes that were made at the downtown library?
Yes, it was the addition of a second guard.
And can you just kind of give us a 1-minute overview of have the changes in ordinances and the additional security change the environment at the downtown library, or is there other changes that need to be made in the near future?
Yeah, we're seeing a really positive change at downtown, and I think the guard, the ordinances, those all play a factor into it, but I also think the work that our team is doing to do more programming. We've done a couple of outdoor programs. We have another one next week or later this week where we're just really activating the spaces in a different way downtown, and that's really brought in a different, a lot of families have come in and a lot of kids are utilizing those programmings that we're offering.
Great, thank you for the update, appreciate it. All right, seeing none, we'll release you at this time, and we'll turn our attention to something completely different. We're going to allow a non-departmental presentation today, focusing on Internal Service Fund and the Director Pritchett with Centralized Facilities. Director.
Good afternoon. Sean Pritchett, Director of Finance, which also Centralized Facilities falls under Finance's purview. I want to introduce Matt Newman. Matt has been our facilities manager for 8 months now, something like that. So we're glad to have him, and he's someone that you should get to know because he takes care of Carnegie Town Hall as well. So just diving right into this, we have a $15.7 million budget for Centralized Facilities proposed for 2027. Our key focused areas are investing in the longevity and safety of our buildings, efficient and effective use of each facility to deliver public services, and creating a positive employee and customer experience for all of our facilities. This area includes all of our custodial care, trades, maintenance of our various city-owned facilities. We have been focused over the last 5-6 years on trade specialization, hiring several people that are specialized in HVAC, plumbing, electrical, and carpenters, so we were able to self-perform more work, but we've also seen money savings having these on hand for our city, both in the way we're doing our preventive maintenance, but also dealing with reconstruction and other maintenance projects. So the facilities team is comprised of 33 people overall who span multiple trades, as I said, in expertise areas. These individuals are helping support most city facilities with that expertise. Centralized Facilities coordinates the maintenance, improvement, and expansion of these city-owned facilities. The Internal Service Fund supports a sustainable and strategic approach to investing in 48 city-owned properties, totaling over 1 million square feet, while planning for future needs. Downtown campus includes the 5 buildings of City Hall, City Center, Carnegie, City Annex, which is where the link is located, and also supporting the transit building. Over 13 fire stations, a fire and a police headquarters, public safety campus, and we also support 13 branches of the library. Our partnerships with parks continues to strengthen and evolve as we work together on these public-facing facilities, including the Westside Rec Center and the Midco Aquatic Center. The main revenue drivers for facilities are an increase in chargebacks to cover an increase in wages and utilities of around 4%. There is also a one-time transfer of $2 million that is used to reimburse the Centralized Facilities for acquisition of the land for Fire Station 13. For those who are here, you may recall that we were planning to lease this land from the Discovery District, and when that fell through, needed to acquire land nearby to keep construction on pace. And so Centralized Facilities put that $2 million out from its cash reserves, and we're looking to get that reimbursed so we can stay on pace with all of the projects that we had slated here over the next 3 to 5 years. Also, as part of our efforts to relieve some pressure on the general fund, we are removing a transfer of $1 million that was being made from the general fund to Centralized Facilities, and instead working more closely through those chargebacks. Major drivers for costs for Centralized Facilities are wages, benefits, utilities, routine and preventive maintenance, including custodial care, and major cyclic projects such as HVAC replacements, new roofs, parking lot repairs, and replacements. We show a reduction in cyclic operating funds as the projects in 2027 are largely capital funded rather than coming from our operating funds. You'll see a reduction of $1.85 million that comes under that major cyclic, and that was dealt primarily with a planned rehab for the fire headquarters project. Instead, we have kind of moved toward working more on the front-facing, forward-facing service sides, and focusing efforts on fire stations that are needing to be rehabbed and have maintenance done with them, 2 of which are in the next 5-year plan. In addition, you'll see facility lease, it goes down by about $286,000. The reason for this is we were looking to lease a facility to use for fire mechanics as well as additional needs for police. We were not able to lease the building. We were looking for a purchase option included with that lease, and we were not able to secure that. So we are currently just reassessing what that looks like, continue to make it a priority, but we're reassessing where that will go going forward. In terms of our capital program, it totals $7.2 million for 2027. The largest project is a long overdue renovation and expansion to the park maintenance and report to workstation on the 49th Street campus. This is a similar project to was completed at the Streets campus in 2022 and 2023. The park maintenance campus was built in 1993 and the size of the park system has nearly doubled since that time. We have nearly 75 employees that report to work at this location during summer months. This renovation will expand bathrooms, of which there are only 2 single-stall bathrooms for 75 people reporting to this station at this location. There are also no locker rooms and limited administrative and shop space. So we'll be taking a look at all of those. This has been a project that's been in the works for many years. You'll also know we're also doing some wetlands, groundwork to reclaim some wetlands that will add an additional 2 usable acres at this facility. We're addressing a lot of HVAC needs, including those of downtown library, city hall, streets, West Side Recreation Center, and as well as the Midco Center in 2027. And then we'll begin a remodeling of Fire Station 8 to update the domestic living areas while adding an addition that will enable the station to be more versatile in the equipment it holds, such as the addition of a ladder truck. Finally, we are looking at some additional updates to the West Side Rec Center, including locker room and pool deck restorations. This slide shows the breakout of the 5-year plan. Outside of the previously mentioned projects, there's also funding for custodial equipment and vehicle replacements. You're going to see it's really top heavy in the first couple of years, 27, 28, as we use down some cash with some of those larger projects that we had noted here in the previous slide. And this last slide just shows kind of the 3-year outlook as we look across our various facilities. In the core areas, Carnegie envelope improvements in 27 as well, which would include replacement of doors and windows, as well as an HVAC cooling tower replacement for City Hall, and then concrete improvements in 28 and 29. For fire stations, we have a lot of HVAC needs there for 5, 6, and 10. Fire Station 8 is planned for remodel again, beginning in 27. We have needs for LEC roof improvements, which is a high priority for the LEC Center downtown, and then also interior and security improvements, including fencing in the out years there. We continue to work at the Streets campus for further needs there. And as far as libraries, it's focused on HVAC improvements at the downtown library, potential remodel as we continue to assess its utilization, and then there's a Prairie West refresh scheduled in for 29. But in the park side, the Parks campus remodel of that campus will be the major projects that we'll be working on, including those indoor recreation improvements as well. So with that, I am happy to answer any questions, or I will ask Matt Newman, our facility manager, to answer them if they're too specific.
Thank you, Director. Councilors, Councilor Thomason.
I might have missed this, but on slide 60, the $1 million transfers in from the general fund. What's that for exactly?
So we used to have a $1 million transfer into there, and instead we're kind of focusing more on just adjusting to those chargebacks. I don't know if you recall, there was a conversation with Councilor McCourse as well, as assessing how much should be coming from the general fund versus capital fund and balancing that out when they're going to these internal service funds as transfers. And so part of that is looking at balancing that and then just getting away from that and relieving a little pressure on the general fund.
Thank you.
Councilor Sigeti.
Thank you, Mr. Chair. One very quick question. I went back to last year's general facilities budget, or centralized facilities, and it said 32 full-time employees, up 0, and this year it says 33 full-time employees, up 0.
Yes, good question. We're transferring one from public parking over for a maintenance position to help assist with the power and light building, which was constructed.
Okay. So that budget's going to say -1?
I don't know. I'll have to go back and look. But that's what happened. We took one position from public parking.
Okay, thanks.
Well done. Bonus points for Councilor Sigeti in the homework today. Councilor Pankinen, coming over to you.
Thanks. Yes, I was curious and just trying to, this is a lot for me to take in these first few weeks. And thank you, Mr. Chair and Director Pritchard. On slide 59 and then 60, so I see this charges to departments is kind of part of the revenue on slide 60, and then, but that's a good slide to stay on. And so there's Parks and Rec there, and you mentioned that that's the West Side Rec Center and the Midco Aquatic Center, partly. So, but more so, if you could go to the next slide on 60, and that's maybe maybe I'll be able to formulate the question a little bit better. Charges to departments, does that mean that some of this comes out of the Parks and Rec department?
Yes, so each of the departments are charged back for their level of services or what we anticipate some of the projects that are going to be forthcoming to them.
Okay, so like on slide 60. Okay, yeah, on slide
Yep.
63, there was 2.4 million between the Midco and the West Side Recreation Center, so about 2.4 million might be a charge to the Parks and Rec Department then?
Correct.
Yeah.
It gets charged across the city based on just their utilization of centralized facilities as well as projects that they have planned here in the outlying years.
Yeah.
We kind of we consider it like funding depreciation is what we're doing. Is they have a certain number of assets, we're asking them to fund the depreciation to make sure we're taking care of them going forward.
Thank you.
Counselor Basie.
Thank you, Mr. Chair. Kind of along that same point, Director, I know you've sat down and I'm a visual person and you drew some really great charts about the centralized facility, this being internal service fund, just so that we can try to all operate on a similar wavelength. My main takeaway from that, and I'd like you to correct me if I'm wrong or expand on it, is that in each department's budget, they're anticipating what their needs might be for centralized facilities, and they're budgeting a portion out of their budget to go into this fund every year, correct?
That is correct. Yep.
So then those chargebacks are planned for by each department.
Those chargebacks are planned for and part of their department's budget. And what that helps do is take some of the lumpiness out of their budgets as well. So it allows time to save up the funds to do a major remodeling of a running library and so forth. So you're not going and taking $1.5 million or $2 million into their budget in a given year, and it's just kind of smoothing effect for them.
Thank you.
Any other questions? I've got two, Director. You know, this is the one budget item that keeps me up at night, is this fund. Two things. One is, what is the current balance of the internal centralized fund? And if you look at the next 5 years, what's kind of our goal over the next 5 years, to kind of have it the same balance as it is today, or, you know, aggressively more go after that when you look at the program that you've laid out here?
I'll have to probably respond to you or back to Jody Moss on that, and probably
Okay.
just give you a current balance, which would be should be in our financial report, but also kind of what we're projecting for balances going forward from year to year based on the projects and when they would hit.
Okay, and then my final will be just philosophical again, asked for is, how would I say to a citizen that the second penny that we're charging you was put on by the city for deferred maintenance and capital projects? What's the difference between the capital projects that we're capitalizing on the balance sheet with the second penny versus the capitalization that we're doing from the chargebacks?
So great question again, as we kind of assess where things are coming from an operating perspective or from the capital side. But it depends on what type of project we intend to be doing. And that can be hard from year to year because you're going to be shifting things. If something breaks down, it may just be an operating expense versus capital. So I'll get you a better response to that question as well.
Great, thank you. Look forward to it. All right, this time we'll head on back to the departments, move to Planning and Development Services, and welcome forward Assistant Director of Planning and Development, Logan Penfield. Good afternoon.
Good afternoon, Logan Penfield, Planning and Development Services. Before I get started, we have three budgets that we're going to present. It'll be the department budget, transit, and then housing. I'll stop in between each for questions so that they're not all waited for the end here. And then lastly, before I get started here, we do have three budgets. They're very different and very similar in different ways. And I just want to say thank you to the whole finance team and Nick Burke specifically for all the work that he's done over the last 6-8 months to help us. This has been a really heavy lift. Going right into it and getting into first off, the Planning and Development Service Department, we're requesting a budget of $18.8 million for 2027. This is an increase of $3.6 million from 2026. The biggest jump comes from the $2.5 million increase on the capital side for the Sanford District land, with the remaining increases due to salary and pass-through funding increases. Our key areas of focus largely remain the same: continue to coordinate regional growth, efficient plan reviews and inspections and enforcement processes, and then continue to connect neighborhoods. Taking a closer look at the budget itself, capital, which I just mentioned, includes $2.5 million for future land acquisition within the Sanford district and $40,000 for the sculpture walk acquisition. We buy the selected piece every year. Bid and lodging taxes are pass-throughs to our outside partners. The neighborhood grant program is funded at $135,000 and included as part of neighborhood services. Community partners funding, consultant studies, and economic development commitments of roughly $1.8 million are included in this budget, and we'll have a further breakdown in a few slides. The rest is largely operational costs, so salaries, technology, training, vehicles, etc. Key initiatives, we're working on the last step of finalizing our 2050 comprehensive plan later this month, and we recently finalized our arts and cultural strategic plan. Looking forward, implementation of these plans is currently getting underway. Specifically, worth noting as part of the 2050 comprehensive plan, it called for the creation of sub-area plans, 11 sub-area plans, and that process is started internally. We're very early on, but we have started that process. As for key service indicators, overall, the last 3 years, we've largely been meeting our targeted goals. For 2025, during our peak busy season, we were down 1 plans examiner, and that caused commercial plan reviews to balloon last summer, which pushed our average up for a good chunk of time there. We're fully staffed, and we're closer to that goal of 25 days now. As you know, Sioux Falls continues to grow at about 2.3% increase annually on the population side, and that requires 700 acres of land to be annexed annually. Planning and Development Service staff continues to guide and support that growth. Annually, planning staff works closely with Public Works to update our growth tier maps. Those are publicly available, and they're widely utilized by the development community to show when sewer, water, utilities, roads will become available. Permit statistics and building valuations. Through July, we're very much on target to issue over $1 billion in total permit valuations again. This is without a large single project that is slightly artificially pushing up that total. Think CJ Foods last year with driving us up to the $1.3 billion mark. Construction valuations have been consistently above $1 billion every year since 2021, and we aren't currently projecting that trend to change over the next 2 years. And as you can see from this slide, our permit value is permit revenue is directly tied to the valuations that we issue. So roughly 0.5% of all permit valuation issued comes back in the form of revenue to help cover costs of inspections and running the department. Revenue budget by major drivers. Grants is decreasing due to hydrology studies falling off and after 2026. Those are state and federal grants. We'll receive the grant revenue this year, and it'll come off our budget for 2027. We are not I just want to highlight this because it's going to be such a large permit, and it might come in multiple stages, and we don't know the time when that happens. Our revenues that are included in this budget is not, we're not budgeting for the Smithfield permit revenue specifically in this. We're just budgeting for a standard $1.1 billion in valuations. Operating budget by major drivers. For planning and development services, almost 70% of our budget is wages and benefits, supporting the employees that provide the excellent services. Operating budget is the next major driver at roughly 16%. This includes technology, equipment, vehicles, and things like wireless computers and tablets that enable our inspectors to deploy efficiently across the community. It includes a safe and reliable network and a large share of the cost of one of the city's most critical pieces of our software infrastructure, which is Energov. The last major area is development partnerships. The budget for the majority of that, roughly $950,000 of that, was established through the Community Partners Program, which includes Downtown Sioux Falls and the Sioux Falls Development Foundation. Additionally, for 2027, there's another 5-year commitment of $500,000 annually for Forward Sioux Falls. Continuing on operating budget, overall, the planning and development services budget, exclusive of bid and lodging taxes, is 11.3 million. That's up $450,000, which is largely accounted for through wages and benefits. The capital plan is pretty straightforward. We have $40,000 for sculpture walk annually, and then 4 years of $2.5 million a year for the purchase of land and assisting in infrastructure at the Sanford district. So this wraps up the planning and development services portion. I'm happy to answer a question on the department.
Thank you. Who would like to get us started questions on this portion of their budget? Going once, twice, not wasting any time. All right, I'll go Logan, just a couple quick ones then. If we look at consulting services or planning and development studies, I think one of the questions outstanding is we've got the Smithfield opportunity before us, we've got Riverline before us, we've got Whittier School before us, downtown parking ramp before us, a variety of things in the downtown area. Is that, and I think there's been some conversation, at least from some counselors I've talked to, about kind of an overall renewal of the downtown master plan, recognizing that things have changed since we originally did it. Do you have a cost on what was when we did the comp plan, and what that sense would be if that was kind of projected of what that would be for a master plan, or could you get that for us?
We can get that and get back to you. That's not
appreciate that. So thank you. Other questions? Councilor Basie.
Thank you, Mr. Chair. You can redirect me if this is not the right budget presentation of yours to ask. But we talked a little bit in Director Kipley's presentation about the, I'm going to use our favorite word again, recalibration of the way code enforcement is maybe looking at tickets. And I would just really like to maybe hear from you how that's going, maybe what efficiencies or savings, whether that be in time or cost savings that we've experienced.
Yeah, absolutely. Thank you for the opportunity to comment on that. So our property maintenance team recently took over a lot of the inspections that are actually happening out in the neighborhoods from the health department. The way that our guys operate is they all have a different section of town, and they're tasked with spending roughly half the day out doing inspections, and they come back to their computers and spend time sending out those notices or working in InterGov, right, and generating those violations. So we took on an FTE in that process. We have inspectors that are out in quadrants of the community every single day. It's an efficient way of processing these inspections. And the overall goal long term, I would say that in the short term or the immediate term, it's not saving any money up front because it was a simple transfer of an FTE. But long term, and this goes for all our inspectors, plumbing, any of the building inspectors, the electrical inspectors, we have a model that we look at for future needs for FTEs. It's based on increases in inspections, the amount of inspections that inspectors can process on a daily basis and an annual basis. There's obviously some seasonal fluctuation there. But the idea is that this can push off the need for additional inspectors for either team over the course of time. So in the immediate term, it was a transfer of an FTE from one department to another. In the long term, the goal is to slow the curve for needing additional FTEs over that time frame. Does that make sense?
All right, appreciate it. Director, why don't you hop into the next area?
Great. Next, on to housing. So for 2027, we're asking for a relatively flat budget, $13 million up from $12.8 million in 2026. Our key areas of focus continue to be to focus on our existing programs and priorities and partnerships, rehabilitate, revitalize housing stock, prioritize strategic community partners, connect residents to resources, and then continue to drive innovation with housing initiatives. Key initiatives, implementing the second year of a 5-year consolidated plan, one-time support for transitional housing, which we can talk about in a second, continuing to develop the low-income housing hub strategy alongside our community partners, produce, preserve, or rehabilitate 225 housing units. We have a goal every year to try to serve 2,000 people in housing impacts across the city of Sioux Falls. And importantly, we're doing this and we're not asking for any new positions to achieve those goals. 2025 investments. In 2025, we invested $8.1 million through housing projects into the community. This is our second year of exceeding $8 million in total investments. We project in 2026 to be right on that amount as well. Additionally, the image on your screen is a really good one that we try to share publicly as much as we can, as just a way to highlight that we don't just work in certain core areas of town, that we try to work throughout the entire city of Sioux Falls. 2027 revenues by major drivers. Overall, we're at the point where our annual grant revenue is less than our combination of general fund transfers and non-federal revolving fund. We continue to focus on long-term financial sustainability when we're out and working in the community, working with partners. We generally try to prioritize loans over grants. That's been a really great way to make sure that we have long-term financial stability. Operating budget, I'm really proud of this graph. We're requesting a $13 million budget for 2026 and plan to administer it on a 6% administration cost, which means that 94% of this budget is targeted to get out into the community to impact new housing, case management, and community partners. Breaking down our budget by major drivers, housing development is the majority of our expenses. Rehabilitation, including the single-family rehab program and the rental rehab program, is next at $3.1 million, followed by community services. And by community services, that's our case management and rental assistance partnerships with Interlakes Community Action. And then we have a community services increase, which is $300,000 in restricted funds to support a targeted expansion with one of our partners. And this wraps up the housing budget, so I'm happy to answer questions on this section.
Questions, councilors? All right, I might have the dumbest question of the day. Sorry if I missed this. Have you been replaced on this team yet?
Yes.
Okay.
Yes. Randy West. Randy, right there, he's sitting in the
back. All right,
there.
Perfect.
Randy's the new housing and transit programs manager, and he started, I think it's 4 weeks ago now? Yes. 4 weeks ago.
Okay, great.
So if it was one more week, we'd ask him to present, but just missed it.
Thank you. All right, move into the next part, rock and roll.
Awesome. So lastly is transit. For 2027, we're bringing forward a $22.6 million budget request. That's up from $18 million or $4.6 million increase year over year. The big jump is mainly on the capital acquisition side. We need to add 5 new fixed route buses, and with a nearly 2-year lead time, we need to get those ordered sooner than later. So we're moving up budget authority in our capital plan to accommodate for this. Overall operations is increasing by a net of $175,000, highlighted by a $600,000 increase in the operating agreement with VIA. That will also include new service through the Green Line to Foundation Park during peak times starting middle of next year, as well as increased peak time operations around Lincoln and Washington high schools. Did I miss that? It's offset with a reduction of $500,000 in repair and maintenance from the completion of the bus depot project, which is underway now and should be completed later this year. For our key areas of focus, they're largely the same: safe, reliable, sustainable transportation system, continuing to push innovation and improve customer service, continuing to evaluate opportunities to replace or repair the bus barn facility. And then just to give you a quick update of where we're sitting right now through first half of 2026, ridership reached 356,000 for the first 6 months, which is up 7% year over year, while cost per ride has dropped by 11%. So that just means we're getting more and more people to choose the fixed route bus system of those increases. Our targeted goals remain roughly the same. 2025 was the first full year with VIA as the targeted or the contracted SAM operator, which is reflected in the 21% jump in 2025. As with 2026, when we presented our targeted growth is 5% again, which we're exceeding currently, and we believe that is a responsible and achievable target. Revenues by major drivers, we're 70%. The transit fund is 70% funded by the general fund and sales tax transfers. The remaining is funded through grants, mostly federal. We receive $5 million in operating funds through the FTA and about $400,000 in federal capital funds that we're allowed to bank for a number of years to purchase. What we do is we purchase fixed route buses with those. It's the easiest way to use that funding source. Operating budget by major drivers, as you can see, the large majority of this, 85% of the operating budget is through our operating support agreement with the contracted SAM operator, which is VIA. The remaining 15% is contracted outside agencies to nonprofit services like Lifescape, the school district, Dakota Abilities, and the majority of the facilities is for maintenance and insurance on the bus barn. Couple of highlights of the operating budget. There's a $400,000 inflationary increase, and then those three different expansion of services to Foundation Park and then around the two schools is a $220,000 increase, so $620,000. The bus depot project shows a $500,000 decrease. Wages and benefits increase due to reallocation of payroll for the housing and transit manager position. So that's split between the housing fund and the transit fund. Of the operation budget, grants cover roughly $5 million of the $13.7 million cost to operate our transit system. Transit capital program. For 2027, our capital budget is $6.3 million. This includes 5 new fixed route buses and $1.5 million for a new fare box replacement system. Roughly 1.7 of the $3.1 million cost to replace those fixed route buses is supported by the federal capital funds. When we talked about we can bank that $400,000 annually, that's what we're talking about. Also of note, the bus stop shelter enhancement project is going to continue through 2027. We believe it should be wrapped up by the end of the year in 2027. To put the capital plan into perspective over 5 years, 2027 is significantly higher than the remaining years due to the drivers in the last slide. We budgeted for fixed route replacements in 2027, and then you see again in 2031, which is where you see the bulk of the expenditures. Key projects, the revitalization of the bus stop and shelters project, which is ongoing now and will run through the end of 2027. We have 2028 on the screen there. The contractor or the third party that we're working with has a timeline to be finished up late next year. Implementation of a new fare box system. Pilot the fixed route extension to Foundation Park, which will likely come on sometime in Q2 or early Q3 of 2027. And that wraps up transit. So I'm happy to answer any questions on that portion.
Thank you. Councilor Pankinen.
All right, I noticed, thank you, Mr. Chair, and thank you, Mr. Penfield. And I noticed the operating support is going up by 620,000. Well, there's 12 additional buses between fixed route and 7 and para-transit buses coming along. So will the SAM full-time positions be going up to operate those 12 buses, or are there some employees already at, it's just kind of looking at that and balancing it all out?
So we're replacing existing buses.
Okay.
So a bus lasts, I think I was told, 10 years. They last 10 years. We try to space out the amount of time when we have to do replacements because of the cost of those. So when we have 5 new buses coming in, we're ordering in 2027, those are replacing buses that are currently operating. So it's not a net increase of bus service there.
Okay, thank you.
Councilor Akue.
Thank you, Mr. Chair. Logan, I had a resident reach out to me, and she asked if the bus route to the one-stop center on Dolly Farm, if that could be free of charge. And I can understand her reasoning behind that. Majority of those riders are captive riders. They're impoverished. They didn't choose for DSS to be moved all the way over there. How much would it cost annually to fully subsidize that route?
So we can get back to you on what it would cost for that specific route to be fare free. I would say that we do have a program that we partner with nonprofits in the county with that offers bus passes for people that need financial assistance. They have to be part of certain programs. It's called the Pass It On program, but there is free bus passes available for individuals that are going through a time of need. But as for that specific question on the cost, we can get back to you on something like that. We just have to sit down and run the numbers.
Councilor Oppenheimer.
Thank you, Mr. Chair. Thank you for the presentation. Just wanted to ask for a little more detail on the shelter enhancement project, what the goals are of it. Is it to get shelters at every bus stop or benches, or what is the final goal?
The number one priority is ADA compliance. First and foremost is we have to get our bus stops all to be ADA compliant. We are working with a third-party consultant, Houston Engineering, to come up with what that will look like. We don't know exactly how many bus shelters that we're going to have yet. That's going to be once we select the different charrette types. So there's going to be a couple different options that we'll be able to place at bus stops. They'll be specifically designed to the city of Sioux Falls, right? And then we'll look at the different bus stops and the usage of those bus stops, right? How popular they are for less. And then what we're going to do is we're going to figure out the budget for that and figure out how many of those that we're actually going to have. It's mostly going to be looking at probably replacing the existing ones and not an expansion of them as far as, one-for-one replacement, but they might be located in different locations based on our most popular ridership areas now, if that makes sense.
Yes, it does. Thank you.
Councilor Basie.
Thank you, Mr. Chair. If I could maybe ask you to expand a little bit more on that with the bus stops. Am I hearing correctly that there's almost, I'll call it like different levels of a bus stop? So what we're talking about with some of these shelters, you say enhancements, like that's...
Sure. So it's going to be, we're talking about the shelters specifically. We're going to have a couple different options on the size of the shelter at bus stop locations, and then there'll be a budget presented to us that we can kind of walk through as to what we can afford with the FTA grant combined with our general fund support for that project. Does that make sense?
Right. So what I'm trying to get at is it sounds like at any given bus stop in the city, there might be a stop that has a shelter. There might be a stop that has just a bench. And then are there stops that have just a sign? Like, are there different kind of what you experience when you go to each bus stop, what's available?
Yes. Yes. It would be multiple different options based on bus stop. So some bus stops won't have anything. Won't have a shelter there, like a large shelter. It might just be a bench with a bus stop, right? With the signage. There might be a large shelter there, is similar to the size that we currently have. Or there might be a smaller kind of in-between sized shelter where there's just a light and a bench there for it.
But am I hearing correctly that the goal is that at every stop, there's some sort of seating or something, that it's not just a sign signifying the stop?
I don't think that's been fully decided yet.
Okay.
We're still, like I said, we just started working through the design process, so we don't have a full budget yet on the cost of each bus stop and then how that fits with inside the grant.
Okay, thank you.
Counselor Thomason.
Yeah, just one quick question on the bus stops. I hope, I shouldn't even say it's a question, it's more of a statement.
Comment, please.
Yeah, thank you. When I drive down Minnesota Avenue or 41st Street, I think that if maybe the routes aren't being used heavily, I think that they need to look at, if it's on a heavily trafficked area, to have bus stops with benches and other things. There's a daycare at 33rd in Minnesota, and almost every day I drive by, there's one or two families and they have a bunch of kids and they're waiting for a bus to come, and where do they go? They're just standing on the side of Minnesota. I get maybe where we won't have bus stops in a residential area where it's maybe a little bit safer, but I do hope that that's a part of what you're looking at, that even though it may not be a heavily used route, but on a heavily used street, that we're looking at the safety of the people that are standing there.
Other questions? Counselor Pankanen.
Yeah, thank you, Mr. Chair. One last question on the fare box system replacement for $1.5 million. I'm curious if after that's, replaced and in use, if people will still be able to use cash to ride the system.
Yes.
Okay, thank you.
Logan, just a couple of things real quick. Counselor Couey, I just wanted to follow up from a comment perspective. You talked about the line going out to the one stop. They may disagree with me on this, something we could debate. I think it would be helpful to put in the budget book moving forward. We got the general fund transfer coming in, but the amount of bus fare that's included in that. So for example, I think it's around $430,000 that we receive each year from bus fares. So if you look at it, you got $430,000 that you're receiving from bus fares. The total budget's $16 million. So I mean, what we're receiving from bus fares towards the overall budget is just not very much. So to me, the question is not a financial question. It's more a philosophical question of how we manage, how we empower people, how we set people up for accountability, and all of that. So I think the conversation we need to have is with our partners in the nonprofit realm and others of how do we make sure we're doing that? Because for us, we can disagree on this, but $100,000 or $200,000 isn't going to break the city of Sioux Falls on the bus things. We're already subsidizing this thing heavily. We just got to find the management side of it. So that's just a comment to consider as you're thinking about that, and we're wrestling with that moving forward. And something to consider moving forward is put that number in here so we have that moving forward in the budget book. But any other questions on the bus situation? All right, we appreciate your time this afternoon. Thank you. All right, at this time, we've made it through all of the presentations this afternoon. Appreciate the administration and the staff being here, sitting here through the whole thing and being available for questions. Very helpful. At this time, we'll open it up for public input. If anybody here wants to speak with the council about any of the items presented on today, you have 5 minutes to speak to the council. Any public input on any of the items addressed today? Going once, twice? All right, this meeting is adjourned. Thank you, everybody.